The other thing that can cause great toe pain is arthritis. Arthritis just means inflammation of a joint. And one type of arthritis that is common in the great toe is osteoarthritis. And in this case, the cartilage wears down over time, usually from genetic reasons, but sometimes after an old trauma. As the cartilage wears down and there are areas where bone begins to rub on bone and you don't have that shiny, smooth cartilage on the surface, it causes inflammation in the joint, which causes pain. Additionally, the body will sometimes form bone spurs to limit the motion of the great toe, and the great toe will get stiff. So a patient can not only have a painful great toe, but they can also have a stiff great toe. When conservative treatment fails for great toe pain that's caused by arthritis, there's multiple different types of surgeries. One type of surgery involves cleaning up or removing arthritic portion of the joint, sometimes bone spurs. This is good for early arthritis where patients have still reasonable motion and most of their pain is with shoe wear from a spur, or they just have a little bit of pain with the extremes of motion. Occasionally removing bone spurs in the joint will provide pain relief and increased motion for the patient. When the arthritis gets bad enough to where this type of surgery is not an option, then there are multiple different types of operations. Some surgeons will attempt to resurface the joint in some way, either using cadaver tissue or tissue from the old patient, and this is called an interposition arthroplasty. This is where you take, again, some sort of tissue that's not normally in the great toe and place it in between the two bones to help with pain relief. This has had mixed results in studies and is not used by all surgeons. The other option for great toe pain secondary to arthritis is great toe joint replacement. While many patients have not heard of toe joint replacements like they have a hip or a knee replacement, it's probably because the results of great toe replacement are not as good as some of the other surgeries, so there are not a lot of surgeons that offer them. At this point, this is still something that's being worked on at research facilities, but we've still not figured out a great way to reliably replace the great toe joint and have patients do well long term. This brings us to the last option, really, for great toe pain as a result of arthritis, and this is called fusion. A fusion is where the surgeon takes two separate bones that are causing pain at a joint and roughens the ends of the bones up and makes them bleed, almost tricking the body into thinking that the toe was broken. Just like a broken bone would heal with two pieces growing back together and becoming one bone, we can sometimes trick the body into taking two separate bones, making them bleed just like one broken bone, fixing them with some sort of hardware, and then hope that the two bones grow together. And if the two bones become one bone, then the patient will lose a little bit of motion, but in return loses pain, because if they don't have a joint anymore, since arthritis means inflammation of a joint, without the joint, typically as the inflammation goes away, as does the pain.